Hello again.
Hi, Rhonda. So
Hello.
welcome. Hi, Dave. Welcome, everybody. So thank you for joining us for the final Meet the Funder session for the second day. We have 4 more tomorrow, so I hope folks can join us for that. My name is Kevin Duggan. I'm the Director of Development here at Games for Change. And so today has sort of turned out to be a little bit of a focus on federal government agencies that are playing a really vital role in supporting the work of our community. So it's a great opportunity to hear from these folks. And just a quick housekeeping note. So we like these sessions to be as interactive as possible. So Dave and Rhonda will be making a brief presentation, and then we'll turn it over for Q&A. Please put your questions in the chat field and share it there. And I suggest you hold it till after the presentation, and then we'll get to as many questions as we possibly can. And second here. So let me introduce our guest. So Dave Miller is the program director at NIH's National Cancer Institute, the U.S. government's largest funder of cancer research and technology development. And Dave is a computational physicist who maintains a research grants portfolio encompassing mathematical modeling, data visualization, and interactive media development. So welcome, Dave. And Rhonda is program officer with the Center for Global Mental Health at the NIH, and her work combines anthropological methods, ethics, data science, and clinical medicine to better understand patient experiences across medically diverse care settings. So two really exceptional people here. So thank you again for joining us. So I'm going to turn it over to you guys. So Dave, you want to share your slides and we'll start the presentation. And just when you're done, just let me know and I'll come back on screen and we'll launch into the Q&A.
Okay, great. Thanks so much. Hopefully everyone can see this all right. So hello, as you said, I'm Dave Miller. I'm a program director at the National Institutes of Health. I work for the National Cancer Institute, and I'm speaking today again with my colleague, Dr. Rhonda Moore from NIMH, both of which institutes are among the 27 institutes and centers that make up the NIH. Now, this year we'd like to dive right into how to interact with NIH program directors like myself and Rhonda, whose job it is to help you navigate your best path forward for applying for federal funding from the NIH. I'll be speaking more generally about the NIH funding process, and then Rhonda will then speak about a number of behavioral health science funding opportunities within her program at NIMH. Now, depending on the health area of interest to you, there's a relevant NIH institute. Recall that the NIH consists of 27 institutes and centers. I managed to fit about half the legacy logos here, and you can see how each institute has its own health research focus. Each institute maintains program director contact information on their website. However, you can always feel free to reach out to me or to Rhonda for an introduction to someone anywhere across the NIH, or even to help you locate such a person. The NIH funds scientific research into understanding human health across the full range of scientific study, from basic biology to disease prevention research, the development of new medical treatments and technologies, the health impacts on individuals, families, and whole populations. I'm using an NCI infographic here, but this range and granularity really is similar across all the NIH. All these areas here are broadly amenable to using games as instruments for data analysis and collection, for therapeutics, behavior modification, health education, and so on, depending upon the goals of your proposed research project. So, if you have an interest in submitting a proposal to develop a research game or to use game technologies in biomedical research, the most important advice I can give you is right here on the screen. Talk to your program director. She or he is the best avenue toward understanding how any particular part of the NIH is currently funding research. If you're planning to develop a game addressing cancer, particularly cancer biology, then I might be the right person to talk to More likely, though, you're interested in addressing some other aspect of human health, and so you'll need to identify a program director with appropriate expertise. And again, Rhonda and I are, of course, happy to help you identify an appropriate NIH contact. Once you've identified a program director, I'd encourage you to put together a one-page description of the research you'd like to pursue. So essentially a summary of your project's aims, your goals, your research team and collaborators, the resources that you have, especially any data sets or unique methods that you plan to use, and then a very rough notion of what you believe the work will cost. So is this a $100,000 project that takes a year, or is this a $3 million project that will take multiple 5 years or more to complete? Your program director will then be able to help you decide on what funding opportunities might be a fit for your proposal. Now, by far, the most common research proposals at NIH are considered investigator-initiated research. This simply means that you, the applicant, completely identify the scope and details of your research plan. These are referred to an appropriate NIH institute and then are peer-reviewed, entirely separate from the program director, and each proposal is reviewed based on its own merits. There are many sizes of such grants, but two of the most common I've listed here are R21s, which are small 2-year awards, and then R01s, which are larger 5-year awards. This is important because this is different than some other federal agencies. Applicants can be from universities, from companies, nonprofits, NGOs, even state and local government entities. And as well, both US-based and international applicants are generally eligible to apply and collaborate on research projects. Again, though, for specific circumstances, it's always best to talk to your program director. Contrast these general programs with more targeted funding opportunities that are put out as funding calls by individual institutes. So as an example, my colleague Tony Beck leads a program that funds health-relevant STEM education games and instructional software. The program supports development of curriculum, interactive teaching aids, teacher education resources for K through 12 grades. And this is limited to just small business applicants, although this is defined rather broadly. Since this program is rather unique in NIH, Tony is hosting an SBIR pre-submission webinar for the program at the end of this month, and details can be found at the NIHCEPA.org website or at a link that we'll put into the chat after the talk. The NIH also hosts frequent workshops, trainings, and other events meant to help jumpstart new research areas, new collaborations, and bridge gaps across different research fields. As one example, the NCI's Cancer Moonshot program is hosting a series of innovation labs on bridging the cancer research and data visualization fields. Already underway for next month will be a focus on how visual approaches and game design can help improve the cancer patient experience. And you may recognize some of the mentors here who will be leading that event. We'll also be hosting another innovation lab in November under the topic of visualizing and interacting with three-dimensional and multi-dimensional research data. As I said, the goal of these innovation labs is to spur new collaborations and build new research teams over an intensive 5 days of ideation and workshopping of research proposals. If you have an interest in meeting and working with cancer data researchers to come up with new visualization approaches and interaction modalities for working with complex data, applications to participate in this will be opening up soon at the address down below. And again, we'll post this in the chat afterward. And maybe one final note, if you're thinking this is great, but maybe it doesn't really apply to the work that I do, part of the reason that I enjoy interacting with the game development community so much is that many of the data management and methods development challenges that exist for developing games also exist for biomedical research. So a method that you develop to overcome some technical challenge in your game may very well be applicable to similar technical challenges in biomedical research. So it's always worth inquiring. So now I'd like to hand the lead over to Rhonda to discuss some of the funding opportunities and activities at her office at NIMH.
Thanks so much, David. It's great to be here, and thank you all for being here today. So I'm Rhonda Moore. I'm a medical anthropologist and a program officer with the Center for Global Mental Health at NIMH, the National Institutes on Mental Health, which is part of one of the 27 institutes at NIH. My programmatic areas are social drivers of mental health, ethics of technology development and use, and with a particular focus in low and middle income countries, climate change and mental health with an overall focus on health equity. I'm also the programmatic lead for the Digital Global Mental Health Technology Program at NIMH. Next slide, please. So this is just a sort of list of some of the research, and similar to David's visual, broadly it covers areas of broadly areas of disease supported by NIMH that are broadly amenable to using games as instruments for data analysis and collection, behavior modification, certainly treatment, looking at adherence, and so on. I'm with the Center for Global Mental Health, but which is part of the Division of AIDS Research, although most of our work doesn't focus on HIV/AIDS. The other part of the division does, but in both parts, we're looking at low and middle income countries designated according to the most recently updated World Bank classification for low and middle income countries. And that can change every year, so it's generally January 1st of the year of interest. And so next slide, please. So the digital mental health, the Digital Global Mental Health Technology Program is the program that I lead. And the broad goals of this program are to advance screening, detection, prevention, treatment, and delivery of mental health services according to those most recently updated World Bank designations for low and middle income countries. And part of the reason that it's been culled out of other programs and built as its own program is that there are significant mental health care gaps in low and middle income countries, including an insufficient number of mental health professionals and inadequate mental health care infrastructures. And also just globally, there's increased mental health stigma. And that's one of the core areas of focus for broadly across our group. Inclusive and effective digital mental health technologies can help address some of the global discrepancies in mental health provision and care. So in terms of the work that we support, we do research on development, testing, implementation, and affordability of effective digital mental health technology interventions, highly innovative digital mental health technology research for prevention, diagnostics, treatment, and management of mental disorders. We also support research that tests sort of generalizable principles and approaches, but also more local contextual approaches in LMICs, encouraging research on known challenges and barriers and uptake, and certainly sustainability or scale of this digital mental health technologies. Research leveraging citizen science or other participatory approaches, including gamification or serious games, and are also supported with the hope of expanding access, increasing engagement, inclusive data curation, and analyses to measure behavior change or active ingredients within behavior change, and improvements in mental health outcomes over the life course of mental illness. As part of it, also, we're focusing on ethical considerations that are associated for research and clinical purposes. And so some examples, widely, a lot of the games that have been supported have focused in HIV. We have a very robust portfolio looking at HIV/AIDS. So we have supported projects that looking at design and development and testing of interactive smartphone games for adolescents living with HIV, and the focus of that is really increasing adherence to antiretroviral therapy, retention in HIV care, reducing sexual risk, and improving or preventing HIV transmission. We also support work that prototypes mHealth persuasive gaming around intersectional stigma, and where the intervention is to reduce intersectional stigma, also assessing feasibility with adolescents, caregivers, and healthcare providers, looking at sort of not only focusing on effectiveness, but also the cost effectiveness of the intervention. And so next slide, please. So funding opportunities. So these are not the only opportunities that exist, but these are just some examples. One is very much tied to my program, which is mHealth Technologies, and that's an R21, R33 mechanism. Some are developmental, so it's an R34 mechanism. So if you don't have a lot of pilot data and you want to build toward the R21, and then of course the parent R01 is another big mechanism, but oftentimes people don't have pilot data, or they need to develop usability or human-centered design studies that take place in the low and middle income country or in the specific low resource setting. And so that takes time to build those relationships, but also to build out. And one thing I want to just share with you, for our project, similar to what David mentioned around the one pager, we're also very, very interested in how people are building out research capacity in the low and middle income country. So it's not just about getting the grant that is focused, you're working here in the States or in the UK or in a high resource setting. You have to really show that the work is being done in the low and middle income country, that you're developing those relationships / collaborations in the low and middle income country. You're also doing the research in the low and middle income country. And then in addition, you're building the research capacity in the low and middle income country, hopefully through, if you're developing an intervention for individuals and communities around sort of poverty reduction, a cash transfer. And that could be a game or gamification, certainly. But if you're designing that, obviously you would have relationships with the university. If it's with schools, you would have it with schools, building toward ministries of health. And then also building out that next generation of researchers in the LMIC and built through collaborations and other types of relationships. And that is supported, and that's something we really look for and take into account. So, and for our grants, in addition to what I just mentioned, in terms of the significance of the study, we're also hoping that you'll also embrace this, a research framework as part of your developmental strategy. It could be a social determinants of health framework. It could be our research development framework. It could be another type of framework, implementation science, but that has to be part of how you're going to not only look at your population recruitment, but also potentially scale your study. So again, please speak to your program officer and work with them as partnership in this grant from the beginning. So next slide. And I think that is, the last, that's all she wrote. So if you have any questions, this is our contact information.
Great, thank you so much, both of you. So that was it was a lot to take in, certainly, and I think one takeaway is that early slide. Talk to your program officer. I think do your due diligence, certainly. Learn as much as possible about what these agencies and programs do. But then reach out and really figure out where your project could possibly fit. I would ask one quick question at the outset. Because this is so research focused, I'm assuming or guessing that the primary of the most common applicant is going to be university. It's going to be come from an academic institution of some kind. But are you open to other kinds of applicants, or partnerships or consortia that bring together resources that sort of span university, corporate, not-for-profit, whatever?
Absolutely. So I mentioned that, non-NGOs, other organizations, folks from industry, from companies, businesses, both large and small, are all eligible to apply. You are correct that probably the vast majority of applicants, or at least a significant majority, do come from academia, but there are entire set-aside parts of NIH funding just for small businesses, just for specific subsets of applicants. And again, working with a program director, you can certainly find those particular funding opportunities. And
you may, forgive me, you may have addressed this in your presentations, but what's the scale or scope of a grant that we're talking about? And I understand that there's different channels and different opportunities. Is it possible to generalize, or is that not, or is not possible for either of you?
I'll go first. So the two that I mentioned were more about the time that you would invest. So 1 to 2 years versus a much larger project with many collaborators. That said, there are even smaller grants. You can get a number of grants that are just for, I want to do this project, but I don't really have any pilot data yet. I'd just like to do a very small study that will take me 6 months to do. You can apply for those, and those have a slightly quicker turnaround as well. Rhonda, do you have any other? There's others for training and other types of grants as well. It's really just, within the scope of what you want to do. There's very likely a pre-existing mechanism, which is all these acronyms that we're using for all these.
Thanks, David. And there are, I'm in agreement with you. There's an R03 mechanism if you want to, you need a little bit more data, but at the same time, it's not a lot of money. But if you just need that little bit of amount of money over a certain number of years, there's certainly training mechanisms. And NIMH just released a slide that has nothing but different types of training mechanisms. There's also mechanisms if you're from a historically underrepresented group around training, but certainly in terms of becoming part of other types of research. And right now there's a real focus across NIH and NIMH, and I'm speaking since that's where I'm sitting, around issues of racial equity and a lot of efforts that are around doing important and inclusive intersectional research and supporting that type of research. So, as David said, if there's a project, there's probably a mechanism to apply, and certainly there. And I glossed over the small business project, and Tony Beck's. He's an STTR program, Small Business Research Project. We also have our own small business, and people can apply for that omnibus for technology development. But oftentimes, if you're for technology development, you have to do a lot of research before you get to that point. So again, talk to your program officer.
Right.
I'll turn it back over to David.
When we heard about from Ed Metz and Diane Hickey earlier about their respective SBIR programs at Department of Education and NSF. So Miguel is asking a question in terms of behavior change games that could apply, but with a global reach, without being specific for lower middle income countries, but including them, would that be eligible? So I think what he's suggesting is that their project might have a global reach that would be inclusive of low and middle income countries, but not specifically designed for that purpose. So
I was just answering Miguel, and yes, it could be eligible because we do support research. So say you're doing work in the States, but you're also doing work in Colombia, and you're also doing work in Brazil. We could support that project. It's just if you're doing work in only high-income countries within, say, a global setting, we're less likely to support that, but there may be another team within NIMH. Just because my group wouldn't necessarily support something that is UK, USA, doesn't mean that there would not necessarily be someone within NIMH, if it's a behavioral grant, that would potentially support that. So, I guess I could say I'm an entree to other NIMH program officers too, for those behavioral research grants, and it's on a case-by-case basis, but certainly if it overlaps a low and middle income country, we could potentially support that type of research. Would love to hear from you.
And would you, prioritize projects where there is a partnership with organizations in the low or middle income countries? A US-based entity could be doing their research in another country. Is your goal really to sort of build partnership? And also you're talking about building the research capacity in these countries, low and income countries. Maybe talk a little bit about that just structurally, if there's something that you prefer or look for.
Well, I think every application is different. So to be able to say definitively what would be a fit for a program, we do have sort of called out programmatic areas within the Center for Global Mental Health. So the areas of interest are certainly implementation science, dissemination research, In addition to that, human mobility, overlapping potentially studies of war or conflict in fragile settings is one area. In my program, I'm interested in certainly social determinants, but the flip side of that is I'm also interested in the uses or development of digital tools to support, or digital solutions to support mental health, delivery of services, adherence, treatment, etc. So I can't really say one way or the other, but until I would see a concept and certainly discuss the grant with you. So I don't want to hedge on that. It's just I don't know exactly what you would be talking about, but I'd be interested in hearing more and seeing what type of solution, or grant mechanism might be a fit, even if it's not, doesn't necessarily sit with my portfolio.
And maybe an additional nuance to add to that would be, and the collaborations that you form and you propose, need to be directed toward and need to support the research goals that you have, right? If you're forming a collaboration or you want to work with someone just because I really like working with these folks, well, that may be one aspect of why you want to work with them. But if it doesn't really serve the research and the goals that you're trying to get to, then that may or may not fit. If it's for a specific program, as Rhonda says, and it has to be, it needs to be implemented and worked in another location, an LMIC or otherwise, then, if you think about what's going to happen in review, they're going to ask, they're doing this completely separately here in the United States. They don't have anyone there on the ground. Do they really understand that setting as well as they claim to? As one example.
Right, great.
Thank you.
So, in the post-pandemic era, what are you seeing? How is that, perhaps I shouldn't say post-pandemic era, in the pandemic era and this phase of it, how has that been affecting either the work that you do, the types of proposals you're getting, the resources that might be available? I don't know if the American Rescue Plan Act has added additional resources to NIH as it has to other sort of federal agencies. What are you seeing there?
I don't know how our funding has changed, but I can say that, the hold that was placed on research last year really was a significant delay. So a lot of the research that was taking place last year, labs were shut down for 4 months. And, a lot of those researchers were quite worried. I have collaborators, I have postdocs, I have students, I have people I work with. I work with the hospital here, and they had to completely change the way they do things, and that impacts my research. For those of you that apply for and attain grants, this is still a flexible process. The vast majority of folks that are impacted by the pandemic and we're doing research, there's mechanisms to help them forward. That 4 months that was lost, it can be pushed forward onto an extension onto the next year. So there isn't any kind of bureaucracy or anything that that might get in the way of that working. I think more on the medical side, people that are avoiding checkups or didn't go to the hospital to get checkups and such, I expect there will be some additional disease burden and morbidity that we'll only begin to start seeing in the coming years. Other than that, we all work from home and we miss each other. That's a significant impact on our side. But that said, it also has made us, much more used to, meeting people on Zoom and interacting with folks in this manner. So I think in that way, it's only going to expand the accessibility that people had toward applying for biomedical research funding.
And I think, for this festival, this gathering, having gone virtual, it has meant, I think, much greater participation from other countries, as we're seeing in some of the questions that were coming in through the chat here. So we'll have a couple more minutes. So Alan is asking, he talks about his work in a Rhino refugee camp in Uganda, and they mostly work with refugees in low-income countries. Do we write all these partners into the application? So I guess, Rhonda, that would be a question for you.
Well, are you trying? Okay. I think that you would write some of the partners into, definitely you have to write in you have to explain it within the grant on what that collaboration is, what each partner is bringing to the collaboration. So, you know, you would have obviously have their resumes or CVs, curriculum vitae included, but also there's space within applications where you talk about, you know, why Mary or why John or Susie or whoever, why they're on the grant, what they're doing and what they're bringing. So that by default will sort of guide who gets included as a partner. And, you know, and that partnership might expand to other people. It's just that you have to explain the research collaboration, what they're contributing, and how they're building out that sort of type of research. And I saw your SBIR, STTR question about money. So there is an SBIR. I don't work with SBIRs. There is a SBIR program officer in our group, and all he does is SBIRs. I mean, he does other stuff, but I mean, so he would probably be, and he works with global, he's in the global group. So I would actually, for SBIR questions, since that's not my program, I would refer you to him, and I'm happy to connect you to him. It's just that I don't feel comfortable given it's not my program. So, but I'm happy to connect you to him so you can ask all those questions about SBIRs, because he's actually the most knowledgeable person about that.
And with that, I think our time is up. And I think, you know, one important takeaway here is really how accessible you are making yourselves, and to help guide people through, you know, a fairly rigorous process. And I think that's really wonderful that you can do that. It's very generous and a great help. And there's a couple more questions in the chat field. So we do have to sort of close the room. If you guys want to hang out a little bit, you're welcome to, or you've certainly put up your contact information. So if anyone didn't have their question answered in this session, obviously reach out to one of these folks. All right.
Absolutely.
All right. So, and again, thank you so much for your time, and thanks everyone for joining us, and we'll see you tomorrow. All right.
Thanks, Kevin.